So what are you doing for ruptured discs, especially in the thoracic spine area?
Okay, so ruptured disc in thoracic spine area is fairly rare. It's like 1% of all the ruptured discs. Most of them are in lumbar and in the cervical spine, in the neck and low back area. But in thoracic spine, it's rare, but it causes a paralysis, and you can be completely incapacitated. And it's very dangerous surgery to do because you have to crack the chest open, take the rib out, push the heart and lung out of the way, and
You've done these? A lot of these before?
I've done that open way, yes.
Okay.
But not the way I do it. I just go through the backside because I have my special equipment, and it takes only 3 hours. And I've done several hundred of these surgeries and presented at international symposiums. And
but I understand you're like a pioneer or like a key thought leader around the world in this particular procedure. Is that fair to say?
I would say that's fair to say, because many surgeons will be afraid to tackle this because it's a highly technical, complex problem, because you have to actually undermine underneath the spinal cord. And spinal cord is right in the way. And only way, direct approach, is go through the chest cavity, but I can do it all through the backside.
Is that right?
I developed special technique. I can take it out, manage it through the backside.
And so if these people aren't getting surgery, how are they managing it? Are they just kind of pushed, like they're just live a life of being on drugs or medications?
Drugs or medications in a nursing home, or just ignored.
So what is it called? Like if somebody Googles this, what is it called?
Thoracic disc herniation, surgical treatment.
Would you say there's lots of, even though like you say, it's only 1% of people, it's rare that you're doing the surgeries, but are there like thousands of people across the country that have it, but nothing is being done?
I would say so, because people are oftentimes ignored. I had one lady, 80-year-old lady, who had this, and another neurosurgeon referred the patient to me. She was in a wheelchair, half paralyzed. He didn't want to deal with the problem because this is a very complex problem. So I did about 3-hour surgery, and I just saw her back 2 weeks ago. She's back up walking, and she's happy as a lark.
Okay.
Wheelchair before the surgery. Now she's walking without any aids and no pain. Before the surgery, she was 9 out of 10 pain and with a paralyzed leg. So it's a dramatic operation.
Yeah.
Because I was able to help her through the surgeries to the backside using my special technique rather than going through the rib and going through the chest cavity. You don't want to violate the chest cavity of an 80-year-old woman.